Hi, I'm Rhonda. I'm a level 1 nursing student. I'm going to be shadowing you today.
Oh, okay. That sounds good. I'm Jasmine, and I am the nurse, and I'm just going to make sure it's okay with the patient that you're with me today. Hi, Mr. Jarvis. Would it be okay if I have a student nurse follow me today?
Sure.
Okay, we're just going to show her how we administer your medications in a little bit.
Thanks for letting me know.
Can you give me an SR report on the patient?
Sure. So we have Ronald Jarvis. He's a 67-year-old male. He's in room 622. He has no known allergies and he's a full code. His BMI is 23.9. He was admitted with a stage 2 diabetic ulcer. He's been a type 1 diabetic for the last 20 years. And when he was admitted to the ER, he had a glucose of 300. He is insulin dependent. As of a couple hours ago, he had a pain level of 1 because he has PRN morphine, so it's on the narcotic. He's oriented ×3, and his Glasgow Coma score is a 15. He wears glasses, and he has full range of motion in all 4 extremities. His lungs are clear and normal sounds, even breath, not effortless. He has a regular pulse in his wrists and feet, and his cap refill is less than 3 seconds. He has normal heart sounds in the S1, S2, no murmurs, no gallop. He has bowel sounds in all 4 quadrants. And right now he's on an 1,800 calorie diet with a 2-gram sodium restriction. He's continent, he voids by himself. Urine is clear yellow at the moment, and he does have an IV in his right forearm. It's a 20 gauge. So his vital signs as of a couple hours ago, his blood pressure is 28/70. His O2 sat is 96 on room air, and his heart rate's a 76. His temperature is 98.4. And we're going to be giving him a couple medications today. Normally he takes Lantus, morphine, gabapentin, and Zocor on a daily basis. And today we're scheduled to give him Lantus, which is his long-acting insulin, and his regular insulin. Right now his blood sugar is a 242, so we're going to have to look at the sliding scale for those as well. His labs right now, everything is looking pretty good. His creatinine's 1, his potassium's 3.8, his sodium is 41, chloride's 104. His glucose was high. It was 310 when he was fasting. And his white blood cell count's 5,000. Hemoglobin 14.5, hematocrit 41.2. And the only thing that's a little low is his calcium right now. It's a 7.4, so we're going to have to keep an eye on that. His albumin is 4.2. So what we're gonna, for our interventions today, we're gonna do a little bit of pain management. We're gonna teach him a little bit about his diabetic habits with his diet. He asked for information about the diet. We have a wound care nurse coming in later to look at his ulcer on his heel. She's gonna dress the room with dry, sterile dressing later. And we're gonna check his vital signs every 8 hours.
Okay.
Do you have any questions for me?
Okay. Why specifically is the client receiving this medication?
Well, he is a type 1 diabetic, so his body doesn't produce insulin anymore, so we have to provide the insulin for him.
What action does the medication have on the body?
The insulin helps his cells take in glucose, because we need glucose for energy, and the long-acting also inhibits the liver from producing more glucose.
When should you question administering this medication?
Well, you always want to check the blood glucose levels. So if his blood glucose was low, normal is 70 to 110, so if it was below that, we would question it.
Does the medication have a therapeutic serum level?
Not exactly, but we always want to check the blood glucose levels before we give it to him, because we don't want to have him go into hypoglycemia.
Which vital signs must be monitored?
We want to check the heart rate, make sure it doesn't get fast, and his respirations. We want to make sure that his blood pressure is within normal limits and that his temperature doesn't rise.
Which physiological parameters should be monitored when the medication is being administered?
We want to monitor, obviously, all vital signs, but to make sure that his blood glucose levels do not go underneath normal limits.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Well, we want to make sure that he's educated about the medication, so, rotating the sites and to know all the signs for hypoglycemia.
What interventions must be taught for taking the medication safely at home?
Well, he needs to know how to administer the medication by himself and to make sure that he throws away any expired medications and also the signs of hypoglycemia as well.
What are the side effects and potential adverse reaction?
Again, hypoglycemia is the main thing, so you want to make sure that if he feels any tingling in his hands or feet, or if he starts to feel nauseous, that those are all signs of hypoglycemia.
How will you know that medication is effective?
Well, we want to check the blood glucose. If the glucose is going down, then that means that it's working.
Okay, great.
Anything else?
No.
Okay, well, let's go and see the patient.
Okay.
Good evening, sir. How are we doing today?
I'm doing okay.
Okay, could you state your name and age for me?
Ronald Jarvis, I'm 67 years old.
Hi, Ronald. My name's Jasmine. I'll be your nurse, and we also have a student nurse that I introduced you to just a few minutes ago. We have a couple medications to administer to you tonight. We have your Lantus and your regular insulin. Do you have any questions about that right now?
No, not right now.
Do you have any allergies that you know of?
No.
Okay. Wash my hands. So we checked your blood glucose a little bit ago and it was 242.
That's pretty high, huh?
A little bit. So we're just going to administer the insulin that you're prescribed and we'll monitor you from there.
Sounds good.
Okay. Okay, so we'll start with your regular insulin. How are you feeling tonight?
I'm okay.
Good. Any pain right now?
No, the morphine I got a little while ago helped.
Awesome. That's good. Okay, can you state your name and age again?
I'm Ronald Jarvis, 67 years old.
Okay, no allergies or yes?
No allergies.
Okay, we'll do regular first. So when we check the medication, we want to make sure that it's not expired, and this one expires in 2020, so they're good there. It's clear. When you get insulin ready, you want to roll it between your hands to mix it up. This is the regular insulin, and today for his glucose level, he's on a sliding scale, and today it's 242, so that would put him at 16 units of regular insulin to be subcutaneously administered. Wash my hands one more time. Put my gloves on. Mr. Jarvis, do you have any questions about your medication today?
Nope.
Okay. Well, I saw in your notes that you requested some information about your diet, and we do have some pamphlets for you to go over.
Oh, thanks. I appreciate that. I did want some more information.
Good. Okay, so when we administer any kind of medication, we want to go over the 5 rates. So we want to make sure it's the right route, the right dose, the right time, the right patient, and I think it's let's go over it again. So we have the right medication, we have the right route, subcutaneous, the right time, it'll be 4 times a day, and it's due at 2100, so we're right in that time frame. And again, it's not expired. Okay. when you open the needle, you don't ever want to touch the needle because it's considered sterile, so I want to keep that. Just clean off the top here. And he was ordered 16 units, so we're going to put as much air in the vial as medication that's going to be taken out. Want a second verification for insulin, so we're going to check. It will be my second set of eyes. So we have regular insulin, 16 units for his sliding scale. Okay. Could you tell me your name and age again?
I'm Ronald Jarvis, 67 years old.
Okay. Mr. Jarvis, we're about to give you your regular insulin. Is there a specific site that you would like me to administer that at?
My abdomen's fine.
Okay. Do you remember where you had your last injection?
The left side of my abdomen.
Okay, so we're going to do the right side and make sure we're rotating our sites, okay?
Okay.
Just doing subcutaneous. Just a little pinch. 90 degrees. And directly to the sharps. How are you feeling, Mr. Jarvis? Everything okay?
Yeah, I'm in good shape.
All right. Do you know all the signs for hypoglycemia, low blood sugar?
Yeah, it's like tingling in my arms and legs, lips, nausea, chills.
Exactly. So you are well educated about that.
Well, if I was a little better educated, I wouldn't have wound up in here with blood sugar of over 300, but thanks.
Well, we're here to help you out, that's all. Get it under control. All right, so now we're going to do the Lantus, which is your long-acting. Oh, we're going to document first, that's what we meant. Okay, now we're going to move on to Lantus. Can you state your name and age for me again?
I'm Ronald Jarvis, 67 years old.
Any allergies?
No allergies.
Now we're doing Lantus here. Let me just scan that. Okay. State your name and age one more time.
Ronald Jarvis, 67 years old.
Alright, so he is prescribed 18 units of this. There's no sliding scale, it's just the prescription. Let's do it 2200, so again, we're right in that time frame. So again, right route, right drug, right time, right patient, right dose. Clean the top of this. Make sure we don't touch the needle. And he's doing 18 units this time, so we're going to put 18 units of air in and take 18 units of medication out. So we're going to verify that one last time. Be my second set of eyes. So we have 18 units. Subcutaneous, due at 2200, so we're a little early, but we're still in that 1 hour window, and Atlantis. Okay. Alright. Can you state your name and age one more time for me, sir?
I'm Ronald Jarvis, 67 years old.
Okay, we're going to give you your Atlantis, which is their long-acting insulin now. Do you have a preference for site this time?
You can put it in my arm.
Okay, left or right? We'll do your right arm.
Oh, the
today,
right
is that
arm.
Okay, okay.
Since you're on the right side.
Makes sense to me. Let's let that dry. Okay, and right in the shorts. How are you feeling?
Feel good?
Good. Do you have any irritation at the injection site?
Nope.
Okay. All right, you remember all the signs of hypoglycemia?
Yep. With
Okay.
tingling and chills and nausea.
Yeah. And if you feel any of those, make sure you hit your call aid immediately, okay?
Okay.
All right. Let me give you that pamphlet for your diet. I'll let you read over this, and I'll be back in a little bit. If you have any questions, we can go over it then, okay?
Okay.
All
Sounds
right.
good.
See you in a little bit, okay?
Thanks.
You're welcome.
I have a few more questions for you.
Sure.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I looked at his blood glucose levels and I made sure that they were within limits before we administered that.
Did this information affect your decision to administer the medication?
It did, because he was hyperglycemic and insulin would lower the blood glucose levels, so he needed the medication at the time.
Did this information affect how you administered the medication?
Could you say that again?
Okay. Did this information affect how you administered the medication?
No, I don't think so. We administered it, subcutaneous is the way that it was ordered. Any more questions?
No, I think you covered it all for me. Thank you so much.
Thanks, Rhonda.
Cut.